no longer be restrained in their purchasing. This is, if you pay me to consume steak, I'm going to consume more of it. All right? It's the same with healthcare. If you pay me to consume it, when I have a need and something arises, to maximize my use of it, my rational approach will be to consume more of it. Okay? All of that leads to an increase in demand, which is intended by the policy, except that we're just saying, well, that's not also going to lead to an increase in price. That is where there's this tension. That's where the goals and the outcomes of the policy are likely untenable. Okay? Let's look at what happens as we have mandated insurance purchasing, subsidized insurance. It's just kind of a summary slide of what we've talked about. Increase in demand followed by an increase in price. And this is what we have been seeing since the 1950s. Now, this has very interesting implications, these mandates by on private employers. This has interesting implications for labor markets. Okay? If we mandate health insurance coverage for employers 50 and above, employers who employ 50 people or more, this is in a sense like a tax. Okay? This is an additional cost of employing the worker. It acts like a tax. We can analyze it very easily economically, supply and demand diagrams, just showing it as a tax on the cost of it. It increases the cost of employing the worker. Okay? When you increase the cost of employing the worker by mandating benefits, you're not increasing their wage per se, but you are increasing the cost of employing them. What happens to their demand for workers? Okay? Their demand for workers, all else equal, is going to go down. Now, they can try to shift some of this cost, because they're going to need some workers, right? So they're going to demand for their product. They're going to try to shift this cost onto their workers. They may cut back on the number of workers that they hire. They may reduce wages to workers and say, hey, we're going to pay you more in cost. We've got to fulfill this mandate, new health care reform. You're costing us more. We have to take that from somewhere. Scarcity exists, right? Again, the idea of no such thing as a free lunch. Okay? Classify more workers as part-time to avoid the cost. Cutting labor hours or outsourcing. Okay? All of these are potential options that are plausible, that an employer would consider given the increase in cost. Or that employer, he or she, could just basically say, well, I throw up my hands, I'm going to keep employing these people, not provide them with health insurance, and just pay the fine that the government has mandated that I pay. But the fine, as we saw earlier, is based on the number of workers hired. So that fine increases. If they just throw up their hands, they say, I'm not going to provide this, I'm just going to pay the fine. That fine is based on the number of workers that they hire. So what does that do to their incentive to hire workers? They're paying a fine for every worker that they hire, over 50, over 50 employees who they do not cover with health insurance. That's an incentive for them not to hire again. Okay? What we're doing here is creating an additional cost on the employer of hiring the employee by mandating these benefits be paid. Okay? Well, if they don't provide insurance, or if the employer doesn't provide the insurance, or if they don't hire the worker, where does that leave the worker? That leaves the worker unemployed and seeking coverage by mandate of this policy through these state-level exchanges or clearinghouses that will try to match them up with some kind of insurance policy on a means-tested basis. On their lower income, that means they're going to pay a much lower premium. That's not going to reflect the cost of covering them. What's going to make up the difference? The taxpayer. Okay? I believe that one of the reasons that we are seeing unemployment is a lagging indicator. But we've been out of a recession for almost 2 years. June of this year will be 24 months that we have been out of the last recession. Since June of 2009 was the last month of this great recession that we had that began in 2007. Okay? And yet the unemployment rate is still hovering around 9%. It went down to 8.9% in February. I believe that it is high and remaining high because employers are very uncertain about the environment of benefits right now in terms of hiring. They do not want to hire if they believe that they're going to commit themselves to additional costs by 2014, 2015, down the road. Okay? And so now the unemployment rate is a lagging indicator, so it doesn't tend to rise until we're well out of a recession. But to have it at near 9%, almost 2 years after recession is over, is unprecedented. Okay? I mean, you have to go back to essentially the Great Depression to find a period of time in which unemployment remained elevated for that long of a period of time and was only brought down because of the massive increase in wartime preparation in 1940-41. Okay. Here is the effect on the labor market. Reducing the demand for workers, decreasing the amount of workers employed, reducing the wages paid to those workers or preventing increases, preventing raises, and increasing the cost. So the Q2 represents the lower level of workers hired that I would predict happening from this policy. And W2 represents the lower net wages that those workers will be paid. And W/C, wage cost 3, represents the higher total costs paid by the employer as a result of this policy, as a result of the Health Reform Act. Okay. Now, there are a couple of political aspects that I want to go over here before we wrap up, and then I want to turn it over to the other two speakers. Interest groups are benefiting from this policy, as you might expect. Okay, it is in their self-interest to have, in many respects, certain interest groups, it's in their self-interest to have this policy. The private health insurance market is potentially one. Okay, they are in a very tough position. They're vilified. Nobody likes insurance companies. Insurance companies are always looking to try to exclude, right? I mean, pre-existing conditions and going back. And we all hear the horror stories. So the public perception of insurance companies is that they are the villain. All right, and as this bill was being crafted, they realized that if they didn't have some input into the process, some input into how things came out, that they'd have to close up shop. Okay, so they, in a sense, kind of, as I said earlier, they kind of sold their soul to the devil, in a sense. They basically said, okay, we will tolerate all of these regulations. We will try to cope with them. Okay, the way that they're trying to cope with them is through gaining economies of scale, merging. Okay, mergers of hospitals, mergers of insurance companies, that's underway already in anticipation of this. Okay. They will try to merge, they will try to absorb all of those additional costs. Unlimited lifetime payouts, unlimited annual payouts, cannot exclude or charge a higher price for pre-existing conditions. All of those are going to run up the cost for insurance companies because the people that are most likely to use insurance are the ones with the pre-existing conditions, the ones who are most likely to bump up against what previously was a lifetime cap or an annual cap, are the people who are most vulnerable. Okay? We're trying to include all of those people. Good intentions. All right? But they're going to increase costs for the supplier. All right? The supplier says, okay, we'll bear those costs. We'll bear up under those. We'll try to cope with those. You just make sure that we have a constant stream of buyers. You make sure that those other 50 million people are coming to us now demanding our product. You mandate it. Okay? That was the trade-off. Now, if you've got a seller selling into a market where the consumer is mandated by law to buy the product that the seller is selling, you're going to have a real time repealing a policy that drives those consumers to the seller's doorstep. You follow me? You have a real hard time saying, oh, well, we were just kidding. Okay, we're not really going to make people buy health insurance. Okay, this is why health providers right now, health insurance providers, are very much up in the air. It's a very uncertain landscape because they don't know what's going to happen. Is this mandate going to get repealed and all those regulations remain? Judge Vinson in Florida said no, can't do it. He cited an inseverability of the policy itself. You cannot say that mandating health care purchases is unconstitutional and then leave in the rest of